Have you ever wondered why, as the years go by, your erections don't feel as strong or as reliable as they once did? You're not alone. This is one of the most common struggles men over 50 face. The good news is that today I'll walk you through 3 powerful science-backed methods that can restore blood flow, boost your erection strength, and give you back the confidence you thought you lost. And trust me, the last method is something almost no one talks about, but it may just be the most important one. Before we dive in, let me know in the comments how old you are and where you're watching from. That way I can tailor future videos to exactly what you need. And if you want to keep learning practical expert-backed strategies for better men's health, hit that subscribe button right now so you don't miss out. I'm Dr. Nora Blake, a urologist and men's health specialist, and together we're going to uncover the tools that truly make a difference. Now, let's get started. Have you ever stopped to think about why your erections don't feel as strong or as reliable as they used to be? I know this can be frustrating and even discouraging, but you don't have to settle for decline as an inevitable part of aging. Today, I want to walk you through 3 science-backed methods that can make a real difference in your performance and long-term sexual health. I'm Dr. Nora Blake, a urologist and men's health specialist, and I've spent years helping men restore their confidence by improving circulation, strengthening the right muscles, and protecting their vascular health. Most men assume the only answer is to reach for a pill, but what I'll share today goes much deeper than that. In fact, the third method is something almost no one talks about, yet it might be the most powerful tool you've never considered. So stay with me, because once you understand how erections really work, you'll see why these methods fit together like pieces of a puzzle. The first truth we have to establish is simple, but too often overlooked. An erection is above all a vascular event. Yes, hormones, nerves, emotions, and even psychology all influence sexual performance, but none of them matter if the blood supply doesn't flow properly or stay trapped in the right place. A strong erection depends on arteries delivering blood quickly and efficiently, and on smooth muscle tissue that knows how to trap it once it's there. Many men believe that testosterone alone controls their erections, or that libido equals performance. The reality is different. You can have normal hormones and even strong desire, but if your blood vessels are compromised, the firmness just won't be there. This is why your heart health and your sexual health are so deeply connected. They share the same vascular foundation. And once you appreciate that, you begin to see why improving blood flow isn't just about the bedroom, it's about protecting your overall vitality. To understand this more fully, let's map out exactly where that blood is coming from and how it reaches your penis. Picture the journey of blood like a river system flowing from a powerful source. The main supply begins in the abdominal aorta, which gives rise to the internal iliac artery. From there, a crucial branch emerges, the internal pudendal artery. This is the gateway vessel that carries oxygen-rich blood directly toward the pelvis and ultimately into the penis. Once it reaches its destination, it divides into smaller arteries, including the cavernous arteries that dive into the erectile tissue, the dorsal artery along the top of the shaft, and others that nourish the surrounding structures. Together, these vessels form a finely tuned network that ensures the penis fills quickly and stays firm during arousal. But here's the twist: problems don't always start where you'd expect. Weakness or narrowing can occur not just in the tiny penile arteries, but much higher upstream, deep within the pelvic arteries, or even at the level of the iliac trunk. That means erectile difficulties can be an early warning sign of broader cardiovascular disease. And that connection explains perfectly why the medications so many men are familiar with, pills like tadalafil or sildenafil, can seem like a magic switch. They're designed to unlock this vascular pathway. Medications work because they enhance blood flow by relaxing smooth muscle in the penile arteries. Drugs known as PDE5 inhibitors act as vasodilators, allowing those vessels to open wider, increasing the volume of blood that enters the erectile tissue. This is why so many men notice immediate improvements in firmness after taking them. But while effective medication is not the whole story, think of it as opening the faucet. If the pipes themselves are weak, stiff, or underused, you'll never get optimal results. Relying on pills alone can be like putting a patch on a deeper problem. It may help in the moment, but doesn't restore long-term function. That's why I always encourage my patients to view medication as one piece of a larger strategy, not the entire solution. When you combine it with methods that strengthen the muscles at the base of your pelvis and train the vascular system itself, you set the stage for results that are stronger, longer lasting, and far more sustainable. And that's where the first of our practical methods comes in, learning how to properly train your pelvic floor muscles. If you've never thought about your pelvic floor before, you're not alone. Most men go through life unaware of this group of muscles, yet they play a critical role in erection quality, ejaculation control, and even bladder function. The simplest way to identify them is the next time you urinate, try stopping the stream mid-flow. The muscles you feel contracting are your pelvic floor. Once you've located them, you can begin to practice without needing to urinate. Start by tightening those muscles, slowly holding the squeeze for 5 seconds, then releasing for another 5. Aim for 10 repetitions in a row and try to complete 2 or 3 sets throughout the day. Stay consistent, and over a period of 6 weeks, you'll notice changes not only in firmness, but also in how much control you have over ejaculation and the intensity of your orgasms. Many men are surprised to learn that Kegels aren't just for women recovering after childbirth, they're equally powerful for men, especially as they age. By engaging these hidden muscles, you build a foundation of strength that supports every other strategy we'll discuss. And once you've established control over your own pelvic muscles, the next step is to bring in an external tool that can help draw even more blood into the erectile tissue from the outside, multiplying the benefits you're already creating. Now let's move to the second method, one that might look deceptively simple but has been a mainstay in rehabilitation programs for decades. Vacuum therapy, or what most people call a penile pump. Imagine a clear cylinder that fits over the penis, creating negative pressure with either a manual or automatic pump. This gentle suction draws blood into the erectile tissue, essentially training the penis to fill more fully and more consistently. Once engorged, a constriction ring placed at the base of the shaft can help trap the blood inside, making it possible to maintain an erection long enough for intercourse. Most men use the pump for 10 to 15 minutes at a time, and while some practice it daily for rehabilitation, particularly after prostate surgery, others find that 2 to 3 sessions per week are more than enough for maintenance. When used in combination with medications like tadalafil, the benefits can be even greater. But here's the catch: improper use is not harmless. Too much pressure, poor fit, or careless technique can lead to pain, bruising, and even tissue injury. That's why I always tell my patients, don't skip the step of getting proper instruction from a healthcare professional before buying one online. When used correctly, a pump is not just safe, but extremely effective. And yet, there's another device that hardly anyone talks about, one that takes improvement beyond the immediate moment and into the realm of long-term vascular and tissue health. Most men who've heard of penile traction devices assume they're purely cosmetic, a gimmick aimed at increasing size. But in the hands of physiotherapists and urology specialists, these extenders are used for something far more meaningful: functional rehabilitation. A penile extender works by applying a gentle, sustained stretch to the penis, not for minutes, but for hours each day. Worn discreetly under clothing, it applies just enough traction to stimulate the tissues, encouraging greater elasticity and improved vascularization. Over time, typically 1 to 2 hours daily for 3 to 6 months, this therapy can enhance erection quality, improve blood flow, and even contribute to modest length gains in some men. But let's be clear, this is not a quick fix. Results don't come overnight. They come from disciplined patience and careful progression. The device has to match your size, the tension must be increased gradually, and consistency is non-negotiable. That's why I often compare it to physical therapy for a knee injury. You wouldn't expect one stretch to heal you, but over months of steady practice, you restore function and strength. For men willing to commit, traction therapy becomes one of the most powerful ways to condition the penis for long-term vascular health. Now that we've covered all 3 tools, pelvic floor training, vacuum therapy, and traction devices, let's bring them together into a clear system you can follow with confidence. So let's step back and look at the bigger picture. We've covered 3 methods that complement each other like pieces of a puzzle. First, pelvic floor training to build muscular control and stability. Second, vacuum therapy to actively draw blood into the erectile tissue. And third, traction devices to remodel tissue and improve vascular elasticity over the long term. Each on its own is powerful, but combined they create a comprehensive strategy that addresses both the muscular and vascular dimensions of sexual health. What matters most is consistency. None of these tools works if you only try them once and walk away. But if you commit 10 minutes of pelvic floor exercises each day, a pump session a few times a week, and traction therapy for those who are ready to invest months into real rehabilitation, you will begin to notice changes. Improvements often show within 6 weeks, and by 3 to 6 months, the difference is undeniable: firmer erections, better control, and just as important, renewed confidence. That confidence is often overlooked, but it's one of the most transformative outcomes. Because sexual health is not just about function, it's about feeling capable, reliable, and connected again. And for men who want to go one step further, there is also a way to support your progress from the inside out. Here's where I introduce the final piece of the puzzle: a natural supplement designed to support smooth muscle health at the microscopic level. It's called Red Boost, and while I don't promote supplements lightly, this one targets a key issue most men don't even know exists: oxidative stress around the smooth muscle tissue of the penis. That smooth muscle is what traps blood inside the erectile chambers, turning a temporary rush of blood into a firm, lasting erection. If that tissue is compromised, no amount of medication or exercise will deliver optimal results. Red Boost combines 5 potent ingredients: L-citrulline, tonkat ali maca, icarian, and nettle root, to increase nitric oxide levels, reduce oxidative stress, and support natural hormone production. Taken once a day, usually as a simple scoop, mixed into water, it works quietly in the background, enhancing the benefits of the physical strategies we've already discussed. But here's the truth: no supplement can replace disciplined training and correct use of devices. Think of it instead as the fertilizer that helps the seeds you've already planted grow stronger. For men committed to a holistic approach, it often becomes the missing piece that ties everything together. And with those tools in place, it's time to talk about how you can take action starting today. So here's my invitation: don't wait for the perfect time to start. Pick one step today, whether it's learning to contract your pelvic floor muscles, ordering a pump and practicing under supervision, or simply committing to a consistent routine. The benefits build slowly but steadily, and the men who stick with it often look back in just a few months, amazed at how far they've come. Remember, this isn't just about stronger erections. It's about reclaiming control, confidence, and the freedom to connect fully with your partner. Sexual health is an investment, and like all investments, the earlier and more consistently you commit, the greater the return. So if this message resonates with you, share it with someone you trust. Subscribe so you don't miss future guidance, and let me know in the comments how old you are and where you're watching from. Those small gestures help me create content that truly meets your needs. Most importantly, let today be the day you stop waiting and start rebuilding. I'll be back soon with a step-by-step plan for a 6-week training program and safety tips for using these devices effectively. Until then, take the first step, stay consistent, and remember, you have more control over your sexual health than you realize.